Well, thank you, Siam, and congratulations to all of you for being here today in this terrific program. And I'm delighted to join you and have a chance to share some of my thoughts and experiences. From, as Siam pointed out, has been the privilege of having worked for 3 presidents doing food, nutrition, public health policy, and continuing to work on it today from the platforms he mentioned. So today I'm going to cover a few issues around food and nutrition policy. You'll see I sort of frame it around there have been 3 really major crises in food and nutrition over in the nation since its founding. And I'll provide a brief history of how we stopped our food from poisoning us, eliminated clinical hunger, but unleashed an epidemic of diet-related disease. And I'll explain how our policymaking process was able to solve the acute food safety and hunger problems, but has failed to control the epidemic of a diet-related disease. And then we'll look into the future of food policy and explain why, for those of you, and it sounds like most of you interested in global health, why this should be, you should consider it to be a top priority. So the first real crisis in food and nutrition in America was in the late 1890s with more of what I'll call acute food safety illnesses. And so Dr. Harvey Wiley was a chemist at the Department of Agriculture, which had been put in place by Abraham Lincoln, one of the longest serving departments in our government. And Dr. Wiley was a chemist there and became concerned that in that time in our country, people were moving into cities. They were no longer getting their food from farms. They were relying on a new industry, processed food. And that industry had teamed up with a emerging chemical industry in the US. And they were producing a food that was a package that could be eaten, that was tasty at a low cost, convenient in cities, but that was also making people sick because of chemicals and other contaminants in the food. And so Dr. Wiley started something called the Poison Squad. He didn't name it that, the press did, but he rounded up, you can see here in the picture, as a part of the cafeteria in the Department of Agriculture. And he rounded up a number of employees and he fed them the food and with the chemicals that were being sold to Americans then on grocery shelves, and demonstrated that indeed these chemicals were dangerous and would make people sick. To give you just one example, we've all had green beans from the farm. They're bright green, delicious looking. You get them in a can and sometimes they're sort of an olive green and really don't hold their form. Food scientists in that day realized they could put copper sulfate, a chemical, in there, and they would stay bright green. Problem is, copper sulfate will make us people sick. If they eat it, might kill you. And so that was something that really wasn't a smart idea. So Dr. Wiley was able to reach out to then President Theodore Roosevelt. Back then, they were just a short distance from each other on the mall, still in that proximity. But unlike today, Dr. Wiley was able to walk across the Washington Monument grounds right into the White House, into the Oval Office with President's office, and sit down with President Roosevelt and convince him that this was a serious problem. And as a result, in 1906, they passed together the Pure Food and Drug Act and the Meat Inspection Act that created what's today the Food and Drug Administration and Department of Agriculture's Food Safety and Inspection Service. And so the result was dramatic. At the time when he raised the problem to the nation and sought to do something about it, these illnesses and deaths were among the 10 leading causes of death in the country. And so they put in place these programs, and over the decades, that number has dropped and dropped to these numbers you'll see here. So this is a study that the Centers for Disease Control puts out every so often. They really need to do it again. This version came out around 2011. But the key things to see here is on the bottom right, you'll see I circled 3,000 deaths per year. That is the number of deaths today due to acute foodborne illness. It's too high. We need to get it lower, but it is 3,000 a year. And interestingly, what this points out here, you'll see there's something called unspecified agents, which means these are things that we haven't figured out are causing food problems. CDC just estimates in their modeling, these are people who are getting sick, are hospitalized, and do die from these illnesses, but they're ones we haven't identified yet, and therefore USDA and FDA aren't doing anything about it. So while they're an estimate of 3,000 deaths overall, only about 1,400 are ones that we're trying to do something about. And then to put that into context here with total illnesses, there are about 48 million, again, a very large number, way too many. But again, if you look at the known from the things that FDA and USDA regulates, it's about 9 million. Still a large number, but resulting in 1,300 deaths. Now, to put that into context, COVID at its peak in 2021 was killing 3,000 people every day. And now another type of what I'll argue is the nutrition crisis of our time, diet-related disease, kills more than 1,400 every day. So 1,300 a year from acute food safety, we need to get it lower, but more than that die every day from the obesity, heart disease, cancer, diabetes caused by our food today. The second crisis came in the 1960s. With hunger in America. So this was a surprise to the nation. We were feeling really good about ourselves after World War II. We had enormous economic growth. The country was really at its, just doing great economically. But the press uncovered that there were Americans who had the kind of hunger no one ever expected to see in the United States, the kind we see in third world countries with the bloated bellies. And indeed, many Americans were sick and even dying from starvation in the United States in the late 1960s due to hunger. Well, this was, I said, it was a shock to the political leaders, the population as a whole. And so a lot of action was taken. The White House held the first ever White House conference on food, nutrition, and health. At the same time, our United States Senate, one of our governing bodies, created a select committee on nutrition and human needs. And through this investigation, hopefully some of you, many of you, most of you watched the video I provided along with the earlier one on the acute food safety problem. But the video does a good job really capturing that moment in U.S. history in the late 1960s when we discovered that there was hunger in America and set about eliminating it. Now, interestingly, well, of course, what we learned was that there was plenty of food in America. That wasn't the problem. It wasn't that there was a shortage of food, and we needed to do that. What we discovered was that there was poverty in America, and I'll return to that in a minute. But as a result, we built an elaborate safety net with programs like SNAP, the Supplemental Nutrition Assistance Program that USDA runs, WIC, Women, Infant, Children, another USDA program, and the School Lunch Program, another program that USDA runs. And I'll come back to it in a bit, but it's a robust budget across all those programs, almost $200 billion today. And essentially, there was it turned out there wasn't political consensus about what to do about poverty, but there was political consensus that the one type of political unrest you don't want to see in your country is that due from acute hunger. And therefore, we needed to make sure that never happened again. And we put in place an array of programs to do that. So USDA, again, its budget, I'll come back to this, but today about almost 200 billion of its budget, 80% of its budget is providing these programs that feed 1 in 4 Americans each year to make sure that there really isn't the kind of hunger we saw then. Out of that White House conference and that crisis, we also came up with other policies, food labeling and dietary goals for America. Now, during COVID, there was a lot of coverage that hunger had returned to America. A picture here of waiting lines at food banks and such. And food banks, if those who know a little bit about them, play an important role in the United States in our food safety, food and hunger safety net, but it's a small part. It's less than 10% of our emergency response system in the United States. Again, because the government responded starting in the 1960s and put in place these programs that represent 90% of our emergency response. But food banks do play a critical role, especially for people who are not here legally. Even if you're here, not a citizen, but you're here legally, you're entitled to all of the programs that USDA offers, or most of them. But if you're here illegally, those programs are not available to you. And then food banks do become the only source of food in a crisis like COVID. And you can see here down the bottom right, Feeding America, who runs all of the food banks, warned everyone that during COVID, indeed, we were likely facing a hunger crisis. Now, hunger, it's a politically powerful term, and I put this slide up only to show you that it's something that's looked at frequently. Is in 2015, the Congress created a National Commission on Hunger to see how we've done, and that what was happening, whether we still had hunger in America, and what we should do about it to eliminate whatever still remains. And they came up with a definition of hunger, calling it what in today's terms, what the USDA calls very low food security. And you can see at the bottom sort of a chart that shows that, and I'll return to this in a minute to show what the numbers are, but just to give you a grounding and framing of it, that food hunger, in the way we define it in public policy in the United States today, is that we have food security. You can see on the chart here, sort of marginal food security, but most Americans, over probably around 90%, are food secure. Then we have a low food security, which is really not the same thing as what we had in hunger in the past. These are people that it's of a concern. It's a very serious problem for them, but it's really that people worry about having enough to eat or make changes in the quality of the food they buy, possibly, to ensure they have enough to eat. And then you have very low food security, which really is, and founded by this commission, said is what's the equivalent in hunger then. Today, if you wanted to use the word hunger, it's people who have very low food security, people who actually change what they eat in terms of reducing food intake for themselves, skipping meals, and lastly, the worst form of it is not being able to provide enough to our children. So let's see how that's changed from the crisis that we had in the 1960s to today. And this is pre-pandemic. This is the Department of Agriculture measures this each year to see how we're doing. And you can see that more than 85%, close to 90% of U.S. households are food secure, meaning they have plenty to eat. There isn't a problem at all. And then you can see in the segment of the pie here that there are houses that have food insecurity. This total pie represents those people who at least worry about having enough to eat. And again, many of those are people that don't have access to the USDA programs, for either because they're not eligible or because they choose not to participate. But more than half of people in this segment are choosing not to or not able to participate in the USDA programs for the reasons I mentioned before. But then if you look at this very low number, which is what we really want to, is the most serious form, and something as a country would be the most urgent, particularly among children, you can see that very low food security in America is down to less than 1% in children. So should be zero. There's no excuse in our country why it's not. All of these numbers here in this pie really should be zero, and USDA works to, and I was there, work to lower those, but that is where we are today. Now, the claim before from Feeding America and other anti-hunger groups that there was a crisis of hunger that came about because of COVID, here's the result to that. So this is in 2021 data, USDA again looking at it and seeing, all right, well, what happened during the pandemic? Did food security get worse? And indeed, the groups are absolutely correct to warn about it. There was every reason to believe that if something wasn't done, we would have a crisis of hunger in the United States because of all the harms that COVID caused. But as you see here, that indeed food security really did get worse. It largely stayed the same. And if you look at individual numbers, it actually, there was less food insecurity during the pandemic than before. So how did that happen? Why, with all the calls, the alarms that were sounded, how did we not have an increase as people predicted, or as many of you may have thought did occur? The general narrative that we hear about food security in the United States, particularly during COVID, is that there was, again, like we had seen in the past, a crisis of hunger. But what these numbers show is that wasn't the case. And as I was just pointing out, that smallest segment is the children who really were hungry in America today, pre and post during COVID. So this is a report USDA puts out. If people want to look at our data nerds like me and want to see what's actually going on, this is a report USDA puts out several times a year, calling their key data report, which really looks at the details of USDA programs. And as you can see, there can be mind-numbing columns of data that show you, though, if you look across the top, the various programs that USDA runs, the SNAP or food assistance main program, but child nutrition like school meals, the WIC, Women, Infant, Children, supplemental, and all told, USDA runs about 16 programs today, and this kind of gives you a deep look into their budgets. So why didn't food security or food insecurity get worse during COVID in America? Well, it's not because people just warned us or we were lucky. It was because of government doing its job, working despite what people say at times. So remember, this was a Republican administration under Donald Trump, rightly criticized on his handling of COVID. But this is one area where they actually did a remarkably good job and did cause, avoided the concerns that people raised. So the number circled here is pre-COVID. And the 2019 shows you the budget of the SNAP, the largest and most important program. You can see here it was a little over 60 billion with a B dollars. Now, looking down here at well into COVID at the end of September of 22, you see that number is doubled. So we went from a budget of 60 billion to 120 billion. And overall for USDA's programs here on the right, you can see they went from about 90 billion total across all the programs to 189 billion, again, doubling across all of the programs. And so Congress responded. And so that's not often in the narrative. People don't say it. As I said, Republican Congress with a Donald Trump as president, nevertheless, sort of reaching the same political consensus that occurred in the 1960s, renewing that commitment was the one type of a crisis you don't want in your country is actual hunger. And so they put in place huge increases in these programs, unprecedented increases, doubled their size. And to put it into context, that 60 billion was doubled from before the Great Recession. So back then it was half of that, but we responded during the Great Recession and we doubled it. And here, once again, in COVID, we doubled it a second time to make sure that all Americans had enough to eat. And this is another data table that shows you the persons in the program. So this shows you that pre-COVID, we had dropped a little, but it was still up around 37 million people, which is a high number historically. And as a result of COVID, you can see March 23, numbers here, a little higher, but about the same, there was a steep increase of people who became food insecure to the point that their income was below 130% of poverty and became eligible for SNAP. But the real reason that growth, that's not a doubling there, as those of you smart in math can see from 6 to 3, it's an increase, but really changed. And what explains the doubling is this column here, which shows that the average benefit per person was $121 pre-COVID. And today it's double that, more than double that. So that's a lesson that was learned from the Great Recession. During the Great Recession, there was a doubling, as I mentioned, but it was really just entirely explained by that many more people becoming eligible for the program and participating. So you double the number of people who participated and the cost of the program doubled. We learned from that, and this time during COVID, there was a significant increase because of people losing their incomes. But the real reason that the program doubled in expense, that was part of it, but the real reason was we increased the benefits dramatically. So Congress, even in the Trump administration, gave all Americans access to the maximum benefits. So people who were receiving the minimum benefit of maybe $30 to $50 a month were suddenly getting, $200-300 or more a month. And so that action that then in the Biden administration went even further by changing how we calculate food benefits, something called the Thrifty Food Plan, which measures how much does it really cost to eat in America. That raised to 25%, plus they gave everyone, including the people already at the maximum, even money. So all those actions by both administrations really made sure people had enough to eat. So what is it, the hunger groups? They are so important. I am a big fan of them. They were called anti-poverty groups back before the 1960s, but they rebranded as Big Hunger, or hunger in their minds, anti-hunger, to make, because they sort of realized that in America, we have a problem about not wanting to do much about poverty, but hunger really resonates with people. So they've really returned to that over and over again. And, but as you can see here, Andy Fisher, who was for most of his career, a significant participant in the anti-hunger movement, points out that, we've tried to address this, but what's happened is, our emergency food systems become an industry. And we have pretended the problem is hunger and not poverty, his words. We pretended the solution to hunger is charity, not ensuring the right to food or increasing the political power of the poor. And so in America, it's confusing. The anti-hunger is important. They help get those increases, and so they're an important political player in this. But a lot of their political power is something they realized in the 1960s. In the 1960s, when we realized that the problem was really poverty, not hunger, even then, President Nixon sought to give all Americans a universal basic income of $5,000. The anti-hunger people, or then the anti-poverty, came to his support, thought they would be able to get this done, and they weren't. And they realized it was because they didn't have the political power. And so they had the insight, though, to take two really important steps. One, they rebranded as, instead of being anti-poverty, anti-hunger, because they knew that resonated more with the American people as a political policy. But second, they realized they needed a powerful political ally to marry to get the political power they sought. And they found that in our big food industry. And so this is from one of the largest anti-hunger groups in America. This is their big annual fundraising dinner, and you can see these are the leading sponsors. I didn't leave any out. You can see all of their top sponsors are the largest food companies in the US, and especially the soda companies in the US. So I'll just leave you with those who are interested in learning more about this poverty versus hunger issue in America. Two really great books that I recently read that I found really helpful, Poverty by America, and There's Nothing for You Here. They really talk about how a lot of the programs we put in place end up not really helping the poor as much as exploiting them to help others. And so we create programs. They do provide some benefits. As I said, with SNAP, overwhelmingly, we gave people more money and they have enough to eat. And so the program's a big success in that regards. But a lot of the programs give rise to an entire industry in the US of nonprofits, other groups who set up programs that are also funded by these government programs. And for them, they result in good paying jobs and careers working in these nonprofits. And the people that are being served don't really benefit in the same way. So it's an important problem to look out how we, in America at least, we create programs that do provide some benefit to the poor, but never really enough to get them out of poverty. In the meantime, there are large numbers of Americans who are making a good living providing services to the poor. So in those, when you look at the budgets, much more if it goes to the people providing the services than to the poor themselves. And Poverty by America is a great discussion by Matthew Desmond of that exploitation of the poor. And Fiona Hill's book is a really great discussion about how her own experience growing up in England, later worked in Russia, saw how the end of our industrial age caused enormous displacement. And then she came to the US and expected not to see that here because of all she had read about the US, but found out that England, Russia, and the United States all have gone through almost identical paths that explain our political unrest and many other problems we face because of the deindustrialization of our nation and really not putting in place programs to help the people harmed. So that's the background of the first nutrition crisis. It brings me up to the one I'm going to talk about in the rest of my talk, the one I think that those of you thinking about careers in global health, global public health, should put at the top of your list. And that's today's nutrition crisis. Here are some of the headlines associated with it. It's our chronic illness, not food illness, not acute, but chronic food illness, diet-related diseases. Diseases such as obesity, now almost half, and it's projected will go above half of Americans are actually obese. It was, in the 1980s, it just wasn't a problem in our country, and yet today it's a very serious problem. Again, it's not just a problem in how sick people are, but it interferes with our military, and of course, even in COVID. I'll go more into that. So the basic thesis here is that Americans are living a shorter, less healthy lives, and that is not something that people expected. This is data from putting up pre-COVID, because during COVID, it's become complicated because of COVID. So a lot of that became the leading cause of shortening lives. There's the opioid epidemic, but right up there in terms of the impact that it's having is diet-related disease. And so in America, we came to believe that life expectancy just increased year over year. And that came to a shocking halt in around 2018, where the first, you can see here for the second time, that the CDC found that life expectancies were shortening. And at that point, pre-COVID, the number one reason for that was these diet-related diseases. And indeed, here, from the life insurance industry, they're seeing it themselves. And one of the large companies there, John Hancock, when I was a professor at Tufts University, came to us and said, we have a life insurance crisis. Our whole industry is based on people living longer, healthier lives. That's how our actuaries had created the systems, provided the premiums to support people living a certain amount of time and a certain level of health. That had not turned out to be true. They had expected to keep getting lives longer, healthier, and they're getting shorter and less healthy. So that means people die sooner. Their premiums don't cover the cost they were expected to cost. They have to raise their insurance premiums. That means fewer people can afford it. The industry sort of starts spiraling downward, and they needed to do something about it. So they looked into their data. They first thought, well, must be things like smoking, exercise. These must be the things that we need to get people to do more of. But and those are problems, and we do need to do more around smoking and exercise. But when they looked at their own data, 2-to-1, what was explaining in their company why people were living shorter, less healthy lives, was this nutrition crisis that I'm referring to today, of chronic food illness. So these are the books associated with this crisis: Salt, Sugar, Fat by Michael Moss, a best-selling reporter. Fast Carbs, Slow Carbs, David Kessler. I helped him with this book. He was the commissioner at FDA that I worked for. We did the nutrition facts label. And an English physician, Chris Van Tulleken, who wrote this recent book, Ultra Processed People. So it's the food that we're eating today that, despite the laws that said that our food shouldn't make us sick, passed more than 100 years ago, are making us sick today. And the government in the US and really anywhere is not really doing much about it. We'll now look into that. So first of all, let me explain more about why it's a problem. Of course, first and foremost, it's that people are sick. So most of you even probably know people in your lives, and not just your parents or grandparents or older relatives, but tragically today, some of your peers probably have obesity as a disease, but more than that, they have diabetes that goes with it. So when I was your age, it was called adult onset diabetes. You had those who were born with a deficiency of insulin and needed to take injections of type 1 diabetes. But then there was what was called adult onset, which has happened later in life. After a lifetime of poor quality diets, particularly, you could get this disease. Well, now that's had to be renamed as type 2 because children are routinely getting this disease. And its most severe consequences of blindness, amputations, are occurring in teenagers, still rarely, but it's now occurring because this disease that once only occurred late in life is now occurring in children as young as teenagers. And so that's a shocking development. So how sick we are throughout all of our age groups is the number one reason why this is such a crisis, because so many people all over the globe are suffering. And even in nations where not enough food is still a big problem, and almost all of them today, this second diet malnutrition crisis of too much of the wrong foods is an equal crisis, even in some of the poorest countries now today. And in all the developed countries, like the United States, it really is the number one food-related problem. But I noted before, there's a cost involved as well. And so not just how sick people are, but this is a study that I'm trying to get redone. It's a decade old now, but it was done after we passed Obamacare, providing all Americans health insurance for the first time, or a way to get health insurance. And it looks at healthcare costs and puts them into a context that we don't always expect. So many of you, if you follow these issues around healthcare costs, you've heard that they're going up a lot, that they're too high. But what does that actually mean to people? So you can say that your healthcare costs are now 20% of your GDP, but what does that mean in individual lives? So what I really like about this study is how it puts it in context and how it warns us about why we need to do something about it. So this top line here shows you the average family income in America from the year 2000 up to the year 2025. And you can see it's projected to steadily increase, not that sharply, but it goes from a little over 40,000 to 80,000 over that time. Much of that's inflation, but there is that average family income. But the cost of healthcare is rising much more steeply. And so one way to measure that is, as opposed to percentage GDP or other things, I think a way that's most relevant to families is what are they paying for their healthcare premium and what are their out-of-pocket expenses in healthcare. And so this charts that and shows how that is changing each year. And what's important to see is that that number is those graphs are projected, those lines are projected to cross in the year 2030. And so what that means, this can't possibly occur, but it means that if we don't do something, just what it costs for our healthcare premium and out-of-pocket healthcare expenses in America would equal the average family income in America. So all the income you make as an average family in America would not even cover just what you're paying for your health insurance. So that can't possibly happen. Something has to collapse before that. So the main takeaway from this chart table is that we don't have much time to solve this problem. When I first started putting this up, it was around 2015. We had more than a decade. Now we have only 7 years. The number 2030 probably has been pushed out a little because in the United States, the Obamacare program has brought down healthcare costs. So maybe we still have a decade or so, but it's not that much time. It's a problem. We focus on climate change, absolutely a severe global threat, but this is a pretty bad threat too. This shows that even in a nation like the United States, if we don't act in the next decade to bring down our healthcare costs, that it will bankrupt the nation in that of time. Now, in a second area important to all nations is our national security and military readiness, and this is from a group called Mission Readiness. And it's a group of 800 former admirals and generals in America who have only one goal for their organization. And that's really that our military is prepared to provide the national security they're there to do. So these are former general admirals. The number one thing that they worry about, their only issue is just that our nation's military readiness is there. And this is a report they first put out in 2009, where they identified that the number one threat that they saw to U.S. military readiness was that 75% of adults cannot join the military because of a number of problems they have in their health, largely. But it includes health, it includes education, includes physical activity and ability to do things, drug use, a number of different issues. Their second report later that year was that the number one, when they went through all the data, was just childhood obesity. That childhood obesity in America is just the number one barrier to military readiness. And they put out a report a couple of years later called Still Too Fat to Fight. And they put out a bunch of reports since then, sort of identifying that if your number one issue is national security and military readiness, well, then this epidemic of diet-related disease is a top priority for you too. Now, I noted COVID before, and I just want to point out that, again, the consequence. So this is an article put out March 30th, 2020, the very beginning of the COVID pandemic. And this professor, David Ludwig, a colleague of mine at Harvard, pointed out right at the very beginning, put America on alert that, the reason COVID is going to be so severe is because we already know that this is a disease likely to cause more harm in people who have diet-related diseases, particularly obesity. And so because of how sick we were, even in 2020 as a nation with these diet-related diseases, he was warning the country that COVID is going to be much more severe than it might otherwise be. And indeed, that has turned out to be the case. So this is a study done a couple of years later, looking at severe COVID and through the metric of COVID hospitalizations. And you can see here that 2/3 of COVID hospitalizations in America were caused, COVID was a contributing factor, but it was really their underlying dietary disease that combined with COVID caused hospitalization. So obesity, diabetes, hypertension, heart failure, all diseases caused by poor diet were what's caused 2/3 of hospitalization. And estimates have been as many as 800,000 of the more than 1 million deaths in America were caused not just by COVID, but because COVID occurred in a population that was just this sick because of these diet-related diseases. So, that sort of underscores from how sick we are and how much people suffer, how much it's harming us in terms of healthcare costs and our economy, national security, and how it leaves us so vulnerable to illnesses like COVID that would be of concern no matter what, but how much more devastating they are when you have such a sick population. Now, what's most disturbing at all to me in this, and different in this country, here's an article that was written in one of our publications, Politico, one that follows what goes on in politics and policy in the United States. And so I gave you all those numbers with COVID, all of that. I also showed you earlier about food security. And so at the beginning of the pandemic, the article I just showed you a minute ago from David Ludwig warning us about the severity of that COVID is going to have with how sick we are, the earlier warnings about food and hunger in America. So at the beginning of the pandemic, the alarm was sounded in the United States, both about having enough food to eat, but also the quality of the food we eat and how severe the consequences will be if we didn't act. And I pointed out earlier how on making sure people had enough to eat, we acted, Republicans, Democrats, the Trump administration, the Biden administration, all went into high gear to make sure that didn't happen. As the data I presented showed you, it didn't happen as a result. And it's because we poured tens of billions, probably all told more than $100 billion into the programs we had put in place after the first White House conference in the 1960s to make sure that we never had a crisis again of hunger in America. And when the warning was sound, those programs worked, which is what government should really be all about. And again, not the narrative you often hear, but that really is just an enormous success story here in the United States and elsewhere, how we put in the programs to avoid hunger in the 1960s. Those programs have grown and worked. And when they were there, when a crisis like COVID came along, and indeed hunger did not increase, even food insecurity did not increase during the pandemic. But what this article points out that the alarm was sounded on diet-related disease at the same time, and yet our country, our government did nothing to respond to it. If you look at $5 trillion in spending that the government enacted to respond to COVID in the United States, more than 100 billion of that, just getting people enough food. There's really just 1 or 2 billion, if that, getting people some more produce and a couple of programs that women and children. That was pretty much it. They're just, for whatever reason in the United States, we just overlooked it. And that's why this picture of the U.S. eagle, our national bird with its head in a fast food bag, is sort of the image of our response as a nation to the risk that COVID presented in this country that's sick. And while we responded to make sure people had enough to eat, power of our food industry kept us from responding to make sure that the food that people were eating improved. And it was in some ways wasn't every country. In England, Boris Johnson faced an awakening when he got COVID, and it was severe because he was overweight and had these diet-related illnesses. He responded by enacting a whole slew of policies still coming out today that improved the diet quality in England and put in place policies to do that. In the United States, Donald Trump had a very similar health experience, but in his nature just absolutely led for no policy changes. And the Congress followed suit. And unfortunately, that's in many ways not changed during the Biden administration. So my point is that, you know, this is the crisis. And so what should we do about it? And my recommendation to all of you is hopefully future leaders in public health and policy and other areas that you may choose as you go through college and pick different careers, that we need to set a national goal in our country and other countries of ensuring that every child reaches age 18 at a healthy weight and in good metabolic health. And it's just so important for all the reasons that I had laid out. And so now, you know, how would we do that here in America? So these are the agencies that we have put in place in our government to improve how we eat, to address the problem. There's a Department of Agriculture. And then within the Department of Health and Human Services, we have our National Institutes of Health that oversees our nutrition research, primarily through these organizations, though also in the heart, cancer. But it's remarkable. NIH, we spend less than 5% of its budget on nutrition, yet all of the big institutes in cancer, heart disease, diabetes, those institutes that, you know, make up almost all of its budget, they're all trying to treat the diseases that diet cause, but we're not answering questions. We don't know, you know, today in 2023, even what is causing the obesity epidemic. Why did we go from it really not being a problem in the 1980s to affecting half the population today? It's not just that people eat more. That is not the case. They do eat more, but it's much more complicated than that, and we need the science to figure that out. And NIH is the agency we have that's supposed to do it, but they're not investing in nutrition science, less than 5% of what they spend money on. We also have the Food and Drug Administration, FDA. I'll return to that, but you know, they're worrying about the acute food illness that they got control over decades and decades ago. It needs, you know, they need to improve that. It's still 1,400 deaths a year. We need to get it out lower. But you know, as I said, there are more than that many deaths every day that they're really not doing anything about at all. They have their head in the sand about it, or in a bag like that eagle. And then our Centers for Disease Control, which again has a small nutrition program, a very small piece of it, but it is another agency we have. And then because of, as I pointed out before, on defense, actually our Department of Defense has a really robust program in trying to improve nutrition for our troops. And so because of the numbers I cited earlier around mission readiness, and it doesn't end with recruiting troops, even those who join the military, many of them become obese and have to leave or get other diet-related diseases that force them to leave during their time in the military. And so it's a priority there as well. But among those agencies, I want to focus on Department of Agriculture. I worked at FDA as well. I worked across all those programs over my career. But I spent 8 years at USDA in the Obama administration, and really learned that if you're going to achieve the goal I set of ensuring every child reaches age 18, this is the one department that really has the tools to do it, and the resources to do it. So, you know, how would USDA be able to, you know, ensure every child reaches age 18 at a healthy weight and in good metabolic health? Well, let's look how many people are fed in America by the Department of Agriculture's programs. So first, and this was a shocking number when I first learned it, in the United States, one of our feeding programs, Women, Infant, Children, that's only available to Americans that are below 200% of the poverty line. So you have to be the poverty line is around 30,000 for a family of four, so around 60,000 for a family of four. You have to be below that to be eligible for the WIC program, and more than half of the infants in the United States are eligible because of that. And so half of the infants born in America are fed through our WIC program. We have child care programs in America that those are less robust. Not everyone has access to them, but we do have them. And a third of them get their food through USDA. So a third of kids in childcare programs in early education childcare, USDA feeds as well. And then virtually all of our school-age children from kindergarten through grade 12 are fed through USDA's school meals programs. And then SNAP, by far the largest program I mentioned earlier, that program, almost half of the participants are under 18. So if we leverage these programs for infants, for childcare, for school meals, and SNAP, you can see we already can get more than well over half of Americans are able to be helped by that. So when I was there, the privilege I had is not only working at USDA, but working with Michelle Obama, who led the effort. So, I can tell you, having worked in 3 administrations, whenever you get the White House on board on an issue you're leading, even for a few months or an event, it's just a really big boost to the work you're doing. And so it's great to have that happen. So whenever, especially a president or first lady makes your issue their top priority, that's really good news and an opportunity to make things better. And Michelle Obama didn't do it for just one event or even 1 year, which would have been amazing if she did it for 1 year. But she did it for her 8-year term, and that's just ridiculous, but just incredible, extraordinary. And these are some of the things she did. The Healthy Hunger Free Kids Act, which I'll say more about in a minute, but should change school meals. Here's the law. Here's her looking over her husband's shoulder as he signed that law into place. She created the Let's Move program out of the White House across all of government to reach the goal of ending childhood obesity. And when I joined and first met with her and her team, and as part of the Department of Agriculture team, and she said, look, I don't want to set a goal that's impossible to reach. Can we really end childhood obesity in 1 generation? And based on all the experience I'd had before joining USDA, I would say, well, no, we can't. That's just, it's just too hard to do. We don't have the tools to do it. But by the time we had met, I already knew from my experience at the Department of Agriculture that Department of Agriculture does indeed have the resources and tools to do this. Here's something, maybe one of you on this participated in this, but we have the president often has state dinners for visiting dignitaries, and this is just an example of Michelle Obama's commitment and efforts she did. Here is a state dinner for kids around healthier nutrition. And then finally, and I'll return more to this, is that she updated the nutrition facts label, something that I've spent a lot of time on in my career. So how did she do, and how, what's the evidence then that this can make a big difference? So I mentioned the Healthy Hunger Free Kids Act, which changed the school meal standards. Here's a study USDA did 3 years after that went into effect, just in 3 years. So in America, we use a metric called the Healthy Eating Index. It measures something, this is in my next slide, but I'll show it here. We have dietary guidelines for Americans. These are recommendations we put out each year on the right. More of you might be familiar with those than the guidelines themselves. The guidelines themselves are in the top corners, or different versions, the first on the left and the most latest on the right. But there's also an icon always associated with the dietary guidelines, which is sort of the public-facing image of the dietary guidelines. And it started off as a pyramid many years ago. Then it became this kind of pyramid I never could quite figure out, with all the rainbow stripes. One that Secretary Vilsack, when I went to work for him, couldn't understand either. And so he directed me to lead an effort that ended up with the My Plate, which is what we see today. And so the Healthy Eating Index is a way to measure what your score is in terms of meeting the dietary guidelines. And so it's on a 100-point score. And the average score in America is about a failing 58, which explains why we're so sick. And indeed, that was the metric that when they measured the quality of school meals pre the Healthy Hunger Free Kids Act, it was that average score of a 58, which was a little better than the average score for kids, but still a failing score. Well, 3 years later, when her changes in standards for school meals were put into effect, and we went out and measured what kids were being served and eating today, we found out that a scale of what was served went up to 81. So what I would call nutrition security happened in just 3 years. In some ways, it's not a shock, because 3 years is a ridiculously short time, but, USDA told schools they had to change what they served, and they did. And so what was being served went from a 58 score to an 81. Of course, that would have had no impact if people were just throwing it out. There were those who claimed that's what was happening, but this study looked at plate waste as well to see if there was any increase after these new standards went in place. And while the media sometimes claimed there was, the actual evidence showed that there wasn't. Of course, there is plate waste. Maybe all of you someday threw away your school lunch, but overall it hadn't changed when they moved to the healthier standard. So that was a huge success for the program. I mentioned the dietary guidelines. Tom Vilsack, who I had the privilege of working for in the Obama administration for 8 years at there, has returned in the Biden administration. And he is just across government the #1 advocate on improving nutrition. He gave an important speech where he announced that his priority in his second term is going to be not just food security, not just making sure people had enough to eat, but nutrition security, a phrase he coined to describe diet quality as a result of this USDA program, something we've achieved through WIC and school meals, but something we really needed to achieve through the SNAP program as well, and something that we haven't done yet. And so to support that, he helped lead in the Biden administration a White House conference. It was the second one. I mentioned the one earlier that gave rise to all of the feeding programs we have that resulted in the progress we've made on hunger. And so we held that conference. It put out policies. I'll note here that this is just in the last line. They're relying, they're not putting, unlike 50 years ago where the government, funded programs. Here, even the Biden administration with Vilsack's leadership is saying, we're not putting money here. We're asking companies to make commitments to put money here. So that's sort of a disappointing about how much progress we're going to make. And of course, as I noted before, I'm not sure hunger really is the big problem today, even though that first conference didn't even have hunger in its name, and yet this conference leads with it, even though we've made so much progress. And I'm not sure they've put in place enough to deal with nutrition and health, but that is the policy. And in fact, I'll show you this article we dug up that was after the first White House conference, 5 years afterwards. The Washington Post wrote this story. There was a Senate select committee I mentioned. They had a hearing. They had appointed a commission to look at the progress made after that first White House conference. And this is 5 years later, seeing how we had done. And here is the summary, which was that hunger has indeed been alleviated. And right here, but nutrition has made no headway. Again, hunger, it's alleviated. We need to do better. It really, the fact that in America still 10% are food insecure and 4% of households very low and 1% of children, those numbers should all be zero. And we need to redouble efforts to make sure that happens. And we know how to do it. We just did it during COVID to make sure it costs putting more money into these programs, but it is a small piece of our overall spending as a country, and we can certainly afford to do it. But the more troubling thing is that there's no headway in nutrition. This article and this headline could be written today, and that's the tragedy that we need finally to do something about. So in addition to the White House conference, there are other reports. Here's one I led with a group called the Bipartisan Policy Center. It lays out strategies for how we might improve the SNAP program to make nutrition a priority. Before the White House did that second conference at the 50th anniversary, when I was at Tufts, along with Harvard, we did a conference sort of looking at how the recommendations from 1969 could have been updated to deal with today's real problems around nutrition. And these were some of the recommendations that came out of that conference. The last thing I'll touch on, just because it's for me, it's something I worked on directly, and it gives you just an insight into what government can and can't do. This is food labeling, and this is the nutrition facts label. And so when I was in college, and this is advice to all of you as you enter college, I decided I wanted to study nutrition. I was really interested in that and wanted to learn more about and understand diet and health and how it affects illness. But it's college. You need to do other things. You should study things. And so I minored in art, and because just trying to get other experiences and exposure to things. And so all those years later, when I was hired by David Kessler to join him at FDA, he said, gee, that Congress had passed this nutrition labeling law. We had to implement it the first year I was there. And he said, I should take some part of it and lead it. And, he knew my background in nutrition. And so I went to the meetings, but I came back to him. I said, David, you have a whole agency full of nutrition experts. I had been working on Capitol Hill for a decade and wasn't the expert in nutrition anymore that some of them were. But I recall from my training about art and design that, how you make a great design, how design artists are able to say where someone looks first and second when they look at whether it's a fine art or a design of something like a label. And so I had the insight that if we could design a label that wasn't like the old label that we were inheriting, which is here on the left. So this is before all of your time, but this is what food labeling looked like in America pre our work in the 1990s. My insight was we could come up with a graphic design to make it iconic, to drive behavior, to get people to do certain things. I like this graphic here because it shows you how from when I took on that task, how working with the team, we came up with the final graphic design that you can recognize on the right. But the first one was the one when I said I wanted to do this, Kessler said, great, but I don't have any money to give you. It wasn't in the budget for this. And so you're going to have to work with the agency artists to come up with a label. And so that next one on the left after the original one was what the artists at the agency came up with. And I recognized that wasn't going to meet our goals. And so I was able to find an artist who could work pro bono with us. And that one in the middle was the first one that he and I came up with, is because we thought that, gee, pie charts, graphics, bars, these things, people really like them. And so that's how the new label should look like. And but then when we tested it, they really liked it. People said, we love these. They're so much more fun to look at. But then we gave them tests to do. Can you pick the healthier food? All these pie charts confuse them. So then we went to bar charts, the next iteration, and that confused them still. And then we went to the next level where we try to put some numbers there using what was the percent of something called the daily value, and then explaining right next to it what the daily value was. That still was pretty confusing. And so we ended up with the most simplest design on the far right. And that's the one, actually, consumers didn't like that very much when we showed it to them back then, but they could ace all the tests we gave them in picking out the healthier food. So that was labeling then. Currently, the Food and Drug Administration is saying that the number one solution to dealing with today's crisis is labeling. We need to change the label. And that's I'm going to explain why that's not the right answer, but here are some of the ideas that have been put out there. And so you can see here's the original label. Here's one that I'll point out on the right that I proposed to them when they were updating the label. Because if you go back to that My Plate, someone recommended that back I showed you for the dietary guidelines, the number one message there is that half our plate should be fruits and vegetables, and we should eat mostly whole grains. Well, armed with that goal, if you're as a consumer say, all right, I want to buy foods that are mostly fruits and vegetables and rich in whole grains, the nutrition facts label doesn't give you any information on any of that. So at the bottom here, I put in ingredients. That's one way to find that out. But other labels that are out there, one I like here that Kessler and I developed in the bottom right, this would put the top 3 ingredients, which would let you know here that whole grains is the top ingredient in this cereal, but in this cereal, sugar is the top ingredient. You couldn't see that from the nutrition facts label, but this here would make that point. This here on the bottom left is the anyone here from Chile, but this is a warning label system they put in that I think we should consider here in the United States, especially for products high in sugar. And again, this is the one I mentioned that focuses on ingredients as opposed to nutrients. And then finally, I gave this in the readings. I won't spend any more time on it, but hopefully you all looked at it. But this is, to me, labeling will only work if the agency, FDA, USDA, sets guardrails for how people design food. So the problem with labeling is, as I had the insight when we designed the label, it does cause people to look at certain things and change their behavior. And And so when you focus on whether it's fat, as the original label did, which was turned out to be wrong scientifically, fat is not the number one health problem we have in our diet. It's bad fat, saturated fats, but they're good fats too. Added sugar is a big problem, but we put that on the label, but companies are taking it off now and replacing it with artificial sweeteners that may be no healthier. And back when we did the original nutrition facts, they lowered all fat, but then replaced it with refined carbohydrates that cause more harm probably than the fat itself alone had caused. And so it's important that the agencies, and as I argue in this op-ed, not just set labels that cause that would encourage changes in behavior in consumers and companies, but then they need to set guardrails, especially for those companies, that ensure that when they redesign the product, they don't design it in a way that's resulted in today's ultra-processed foods that make us even more sick. So that's the end of my talk. I can be reached and seen at these addresses, and I look forward to your questions.
So I'm Kate from Denver, Colorado, and I just wanted to say thank you for your talk. It was really meaningful to have someone from so many different presidential organizations can speak with us. So my question was, how can we ensure that people have access to healthy food systematically without just pumping more money into SNAP and other programs like that? Like, how can we make individuals more independent and wealthier to be able to afford healthy food?
Yeah, so two parts to the answer. As I noted, we should end poverty in America. It would be hard to do all over the world, but we have the ability to do it in America. We just choose not to. And the books I pointed out to you give a discussion about how to do that. It's not, it will cost money, maybe as much as $200 billion a year, but to put that into context of all of the other things we spend money on, it's a very small part of our many trillion-dollar budget. So we need to end poverty. We need to make that the priority, not just make sure people who are in poverty have more food. And that comes from really, it's interesting, the United States, those who studied history, after World War II, the world had completely changed. And we sent all of so many young Americans went and fought in the war. They came back. We realized that their lives had been completely upended. And we passed laws that gave every one of them a college education in something called the GI Bill. And I benefited from that. My dad fought in World War II and came back and wouldn't have been able to go to college in the family where he grew up. And he now got to go to college, something he wouldn't have been able to do. And then we grew up, I had a home in Connecticut, really nice. He only got that because there was another GI Bill that gave everyone who came back from the war a home. And so he had that as well. And the thing is, and not only did we do that for our returning troops, but for those who were in Germany or from Japan, the countries we defeated in the war, we had the Marshall Plan to help them. And so even our enemies, we felt we had the resources to help them. Not that we were foolish, we were just smart enough to know that if the world's going to work, we need to, they shouldn't be our enemies anymore, and we should help them and benefit in the long term. In the books I sent you, Poverty by America and Fiona Hill's book about the industrial, we went to globalization, not just, the United States, all over the world. Leading countries decided that much wasn't a war per se, but in a way it was. It was a complete change in how society was operating, and in a way, all of the victims in all these countries. In Fiona's book, in the United States, we saw it first in England, and then in Russia, and then finally in the United States. But a lot of people lost their jobs as a result of globalization, but we did put in place the programs we did after World War II to make sure that it's fine. Globalization happens. It's not what people wouldn't necessarily want, but we're gonna, we're there to help you. We've created a safety net for you, and we did. So that's one part of it that I think was inherent in your question is we need to deal with poverty, not just making sure people are poor, but at least they have enough to eat. That's just not sufficient. The other thing, though, is what I mentioned in terms of the design of food. The good news is we don't have to change the law. The Harvey Wiley law, written in 1906, just makes it clear. He was worried about processed food, and the law says processed food can't make you sick. I think what I presented and what I argue is that our processed food has never made us sicker. Back in his time, it was one of the 10 leading causes of death. Today, it's number one. And so we need to do that. Our agencies, they don't need a new law. They just need to have get the resources from Congress. But even more important than that, they need to put in place leaders who will make enforcing the part of the law that says our food can't make us sick, apply that to chronic illness, not just acute illness.
Thank you. Next, we can go to Arkan from California.
Yeah. Thank you, Dr. Mande. I really enjoyed your presentation. So I have a couple of questions. First is as teenagers, how can we, as like a young part of a new generation, how can we help to ensure our nutrition as well as help others in nutrition?
Yeah, so first, great question. First thing is because everyone can make a difference. And really the first place you can make a difference is in your own life. So that's a great question, Arkan. You can start by learning more about nutrition. The simplest advice I can give you, which was in that my plate, when you look at your plate, make sure that half the plate is really fruits and vegetables, and that meat is more of a side dish at best, but really even better would be a condiment. It's something you can put on food, but that really plant-based foods are the foods that are essential not only to good health, but also to the environment and climate. So it's something that you do for yourself, but then as you do it for yourself and you spread that out amongst your friends and families, companies are about selling what consumers want at the end of the day. They do market to you to try to influence it, but that as consumers demand a change in the food system, they will get that. And so companies like in the US, Coca-Cola, PepsiCo, I mean, they still sell a lot of soda, but they also sell a lot of water and other beverages now because they're trying to respond to consumer demand. So I think start with yourself, learn more about nutrition, but the simplest advice I can give you is to try to base your diet mostly on plant foods and change your buying decisions to send that signal to companies.
Okay, thank you. But I also want to add something though, is that even though you can add you can replace your diet with plant-based foods, but I have actually been trying this, but the problem is that I still feel hungry anytime I do that. And so I later realized one time in school that you have to add protein to your diet. Do you have any ways how you can do that?
Yeah, so plant-based foods include proteins, fats, and you're right, it does need to include the proper amount of protein and fat. And sometimes if there are, just because it's plant-based, it's not necessarily healthy. A Diet Coke in a way is plant-based, or chips are plant-based, and there's a role for those in your diet. But overall, you do have to pay a little bit more attention to know where the protein and fat are coming from. And you have to have enough fat and protein in your diet. So you can do that with foods like tofu, for example. You can do it through legumes and beans. There are plenty of ways to get plenty of protein. To give other people time, I can't go through all of it, but if you look that up, you will find advice on how to do that. But it's a great point. I think just saying it's plant-based isn't enough to make it healthy. You need to look into it a little further to do that. But there are a lot of great organizations out there that if people let me know, I can give it to Siam and others, other resources you can contact.
Also, you also mentioned that we can end poverty in America.
Yes, Arkan, I'll step in but just because 99 people I see are on the list. So I appreciate your questions, but let's give everyone else a chance. And if you want to send me other questions in writing, I'll be happy to answer them.
Sure, I'll see if I can email. Thank you.
Okay, great. Yep, sorry to cut you off.
Thank you. Before we go to Catherine, I'm going to go to one question in the chat, which has a lot of students who have given a thumbs up. They ask, Sanjana from Texas asks, one reason that people consume processed food is more often is that because it is more affordable. For this reason, should we raise prices on processed food and reduce prices on healthy food?
So two parts to answer to that question. It's a great question, and it really goes to the heart of the problem and why I'm advocating and saying labeling is just not the answer. Because labeling gives people more information on which to act, but if they don't have the means in which to act, what good does it do them? And so I would argue that, a lot of my nutrition colleagues say that, if you want to eat a healthier diet, going on to Arkan's question some more, eat locally grown foods, go to your farmer's market, get those foods. That's great. I mean, I tried to do that in our own family, but that's really a privilege and a luxury to eat that way. And for even in America, for most people, the things that come first, and really even for me, come first are taste, cost, and convenience. And when you put those first, taste, cost, and convenience leads you to ultra processed foods. They taste great. They're inexpensive, and they're really convenient, time-saving to make. The problem is that the law already requires that they shouldn't make you sick, and that needs to be a fourth criteria. You shouldn't have to do that individually to find the food that is processed, that's cheap, it's also healthy. And so that's why labeling is not enough. We need to insist that FDA, USDA enforce current law and force companies to make these highly processed foods. I'm not looking to get rid of them. I'm just looking to make them healthy. Way in the future, maybe late in your lifetimes or maybe in your grandkids' lifetimes, eventually as we go to other planets and elsewhere, we will need to be able to make food from scratch, not just grow it in plants. We'll always want to grow what we can, but we'll need to also, those of you who want to study science, pull the molecules out of the air and create food. There isn't actually even a company today, Air Protein, that's doing just that, pulling molecules out of the air and creating food. We need to be able to do that, but those foods should make you well. And the reason we can't do that today is we don't invest enough in the science to do that. So we need to make sure that our foods make us well, especially those that are processed foods that are, because people should demand foods that taste great. The number one thing should always be about food is delicious. And if it doesn't meet that test, it really isn't the kind of food that people should be eating. But then also, there's no reason that it can be delicious, highly processed, and make us well. We just need to demand that. And the government needs, companies aren't going to do it on their own because there's no financial incentive to do that. So the market doesn't provide that. So it's a market failure. What do you do when there are market failures? Government needs to step in and provide the rules. That's what FDA and USDA need to do here.
Thank you. Next, we'll go to Catherine from California. There you go. You should be able to unmute now.
Yeah, thank you, Dr. Mann, for your eye-opening presentation. It was really interesting to listen to. But I come from a pretty rural community in Asia, and we don't really have a lot of farming or basically a lot of access to non-processed food. And often, yeah, it gets expensive, a lot like other questions I were asked. So I want to know, how do we improve this accessibility for people who are really far away from organic foods and don't have the ability to do it themselves?
Yeah, so that again, why we need to make sure that the processed foods are things people can rely on and eat every day and be healthy and certainly not make us sick. And that's why somehow we allowed the FDA. Again, that it's not that they weren't thinking about it; they just didn't have the resources. They have other problems that were put in place. FDA was created, as I mentioned, back in 1906 at the Department of Agriculture, but then in the 1940s. When they were given authority over drugs and cosmetics and other products, they were moved out of the Department of Agriculture, and food became less and less of a priority till today, where somehow they're stuck in this time warp where both agencies are still focused on the problem of acute food safety, which is still with us, but it was the problem of 1906, and it was then one of the 10 leading causes of death. And no one on this Zoom has had a family member themselves had the kind of foodborne illness that can be life-threatening, that does kill children occasionally, but it's very, very rare. As I noted, the 1,400 deaths a year that still come from these acute foodborne illnesses. We have more than that every day. And really twice that with COVID at its peak, and more than that every day from chronic illnesses. So we need to continue to do more to bring down the acute food illnesses, but we need to use our laws to make sure that companies, the foods that they're designing, can be eaten daily and not make us sick. And otherwise, I agree, it's going to be tough to do because, as all the reasons you mentioned, people don't have, they have access to the foods that they can buy at stores that taste good, that are cheap, that are quick to prepare. And they need to, the whole idea of food is you need to be able to eat those every day and not get sick. And as I said, the good news, that already is the law in America. It's just that we're not implementing it. And it just requires a leadership to do it. And so I didn't want to get into it, don't have time, but the other thing I did when I was FDA is we did tobacco. So I'll just mention it here as an example. tobacco, and still in many countries around the world, a leading cause of preventable death. And when we started working on it, when I was at FDA, a third of adults and a quarter of kids still smoked, and it was by far and away the leading cause of preventable death. That's changed. Now these diet-related diseases are number one. But the good news is in the latest data here in the US, only 11% of adults are still smoking and 5% of kids smoke. And we can see how within one generation, as the older smokers age out, is that we will have solved that problem. So it can be done. In fact, it was done at FDA, where regulating tobacco was a stretch. It was created to do food. So it can do it. It just needs the leadership to do it. And you all can help by using your voices and your votes where you can vote to say that these things are priorities.
Thank you. Next, we'll go to Arushi from Utah.
Hi, thank you, Dr. Mande. I really enjoyed your presentation. My question is, with the recent rise of veganism, vegetarianism, and like more plant-based and healthy food options, like between the upper class, like it's kind of trending, do you think this will lead to more government policies and corporations trying to focus on healthy eating as a whole?
Not without government regulation, unfortunately, which is why I think it's so necessary. Because in the US and in most countries, we rely on the marketplace to drive corporate behavior, and their metric, their dashboard only has one metric on it. It's their profits, how much money they're making. And I think ultimately these are issues we probably need to address as well as a society, and you all, as you enter a college, need to think about is how do you, the problem with our system is that that profit-based system is that it relies on constant growth. And that growth has lots of costs to it in terms of environmental damage, other damages that are not built into their cost. If companies were assessed, and someone asked this earlier about a tax, I didn't get to mention that. A tax is a great way in our current system to achieve that. So we did that with tobacco. That was one of the reasons we were able to succeed, is we put really large taxes of $1 or more on a pack that kept people even who were addicted stop smoking. We're playing around a little with taxes in food, but it's usually now just pennies per product for soda. It's not enough really to change behavior. Indeed, I think the advocates are misguided in that those kinds of price increases generate revenue that might be able to be used for something, and that's helpful, but I don't think it's sufficient to really change behavior. So I think we need to really just recognize that we need shifts in policy that reach everyone. And that's what government's there to do. And for those who pick that as a career or those who end up in industry, there are industries, I think industries are becoming more responsible, are at least aware of this. But in the end, as long as the marketplace doesn't put it, it's when the marketplace is going to put on their dashboard a gauge about profits. The government, and we the people need to put a gauge on their dashboard about health and the environment to make sure that that's an equal part of how they do business.
Thank you. Next, we'll go to Akrup from California.
Hi, I found your presentation really interesting, especially since I'm also involved in like nutrition and also tobacco prevention. But my question is, how do you approach like the issue of body positivity in the context of addressing obesity? And are there ways to promote positive body image without undermining the efforts to combat obesity?
Group, that is such a good point, and one I really struggle with, because when I look at the playbook we developed for tobacco and how we were able to succeed there, the number one thing we were able to do is denormalize tobacco use. So the history of tobacco use in America and really globally is, for any of those who tried cigarettes, the first few times you try them, there's just nothing going for them. They make you sick, you cough, you smell bad, and as a product, why would you do this again? Eventually, there's the drug effect of nicotine, and there's some benefit people find from that. But the first few times you try it, it doesn't provide that really, and that drug exposure makes you sick. Well, the industry figured out how to create a marketing campaign to make it cool, and so they literally we discovered at the Smithsonian museums in the United States an oral history from the companies that laid out how they achieved that. And so how they were able to change America so that smoking was really cool. So now we had to denormalize that. And that's what we did. And, to give you a classic example of how we did that, the industry would put out ads that shows out how smoking makes you sick. And it was interesting when we market tested those ads that showed you that, cigarettes would make you sick. Well, parents loved those ads, thought they were great. Kids actually were more likely to try smoking once they saw that it might make you sick. Go figure. But, kids are the way they are. When we showed the ad we came up with that was really effective was one that showed a bunch of suits in a boardroom laughing and how they've convinced kids that smoking is cool and got them to do it. And it was that sort of denormalization that smoking is cool that's led to the success we've had. You're identifying a chief problem. So on diet and health, what is it that we're trying to denormalize? Tobacco at its highest level, as I mentioned, the US maybe was back when even doctors advertised smoking around World War II, it was 40% of adults smoked. So it was never even half of Americans smoked. And by the time we started working on policy, it was a third. Problem with overweight and obesity is almost half the country now, and 70–80%. And so it is so normal, it's almost impossible to denormalize. And the result is what you're experiencing and what you talked about. So when I've gone and worked with groups and said we need to reduce obesity, I get a lot of pushback that I'm body shaming by even using the word. And there are a lot of public health groups that want to eliminate obesity as a word altogether. And I get it, because as a society, that is now the normal. And it just, you can denormalize when it's not normal, when it's just a lot of people, but the majority still don't agree. And so that's what happened in tobacco. You could pass a law that says you can't smoke publicly because even though there are a lot of people who are doing it, the majority disagree. When obesity and overweight becomes so common, that's our challenge. That how do you convince people who are overweight and obese to support policies that seem to say that's a bad thing? And I think what I put forward as a goal of make sure kids reach the age of 18, it's still a small number, though a growing number, as much as a quarter of kids who are overweight and obese. But we can bring that down. And I think we need to focus there and just sort of say that adults are adults, they're free to make their own decisions. But as a society, we do need to reduce overweight and obesity. But you're right, we need to be sensitive to the body shaming and how normal it is in society and how to do it in a way that doesn't discriminate. Absolutely important. Great point.
Thank you. We'll try and get to a few more questions, and sorry.
I'll give you an extra 5 minutes. So
okay. And then for the students we won't be able to get to, Professor Mande, are there any resources or places you recommend they turn to have their questions answered?
Yeah, I will send you a list, and you can start neuroscience, which is the nonprofit I started. There are a lot of things right there you can look at, but Department of Agriculture has a lot of great things. Unfortunately, I point to other groups, but I don't really think many of them are working on the right issues. So, but send me. I will send you a list, and if you send me a bunch of some of the questions, I'll try to get to more of them.
Okay, sure. So next we'll try and get to a few more. Vinay from Utah, you should be able to unmute now.
Yes. So thank you for coming and presenting. So my question is in terms of the economic incentives for food. I think you were talking a bit about this earlier in terms of taxes on tobacco and other items, for example. I know about I've heard about New York's soda tax working pretty well. So I was wondering, what kind of economic incentives are the USDA and FDA thinking about now? So besides just taxes and subsidies, what other options does the US government have in terms of economic incentives to get companies to produce healthier food rather than just change consumer behavior?
Yeah, for government, taxes are sort of the most straightforward way of giving companies incentives to do that. And then regulation is the other way. So if you say that the law requires, for example, when I give you more detail, what I'm speaking about when I say FDA and USDA should set guardrails around the design of food. So there's some things we already know, like sodium. The US FDA last year, after it took them almost a decade, they put out some guidelines, sort of hoping companies will lower sodium. They have the authority to make that mandatory. And so they should just say to companies that we need to gradually bring down sodium. That's what we did in school meals. That's how we got those kinds of healthy eating index scores, as we simply said, you need to start bringing down sodium. And the incentive is, in a way, is inherent in those programs. So when we first did the nutrition facts label, we put sodium on there in the hopes that consumers would see that they would want to lower the sodium. And we even encouraged companies to lower sodium. But the way companies responded was they, put out a low sodium soup. They put less sodium in it. It didn't taste good. They didn't really worry about it. If people didn't buy it, so what? When this is where USDA's power really comes in. When USDA said for school meals, you need to lower the sodium, what they were telling companies is, if you just lower the sodium and it doesn't taste good, kids won't buy it and you won't make any money on it, having it in the school meal program. So you need to make it both lower in sodium and delicious. And that's what companies set out to do. And so that rule, when companies tried to lower sodium in their products, they just put less in and it didn't taste as good. And they kind of just shrugged and said, we tried. When it became, if you wanted access to the tens of billions of dollars in the school meals program, you had to produce food that was lower in sodium and tastes great. Well, then they all of a sudden called in new scientists to figure this out. And they literally invented hollow salt crystals as a way that, it had the same salt taste, but didn't provide the same level of sodium. We are so smart. Those of you in science, you do such remarkable things already that people couldn't imagine before. We can create food that doesn't make us sick. We just need to make it a priority and invest in the science. And once we do that and force companies to, do the same in their investments, we can do that. And there may be additional incentives and tax credits, other things you can do to get companies to do that. But I think the biggest is USDA to leverage its market power. It has $190 billion in food programs this year. We're leveraging a very small percent of that. The program we really need to leverage, SNAP, which is 120 billion of that this year. Today, we're not leveraging it at all. We need to use that to put pressure on the marketplace to produce foods that don't make us sick.
Thank you. I will try and get to a few more questions. Next, we have Rathna from Georgia.
Hi, Dr. Mande. This was a really interesting presentation. So thank you so much for sharing. My question was more like on biotechnology and agriculture. So like specifically GMOs. So I know like GMOs, they can help increase food production and also increase the amount of nutrients in food. So they can help with like global health issues like food insecurity and malnutrition. But a lot of people are skeptical about it because it's kind of like, we don't know much about it. So what would you say about it? Like, what's your stance on GMOs? How much do you think they could really help with like the food insecurity issues today?
There does need to be, it's a great point and it's a great question. And there does need to be a shift in thinking and you all can help. But let me preface that by saying something. I have two boys who are in college. And I know that the thing that pisses them off the most is when people say, we're looking forward to your generation solving the problems that we haven't solved. And he gets really mad and says, you still have the wealth, you still have the power, you need to solve it. So I absolutely believe that. And so it's today's leaders, it's today's people who are there who really need to do that, but you all can make a difference as well. And GMOs is a great example of that. There's nothing inherently unsafe about GMOs. And, but, we need to look at the final product and we need to look at unintended consequences. All those things matter. But to give you a very specific example, if hopefully most of you are familiar with something called CRISPR, which is a new technology that allows us, originally when we did genetic modification, we didn't really know how to do it. We kind of inserted the new genes through a bacteria or something, and we just hoped they went in the right place. And so there was more reason to worry what were the unintended consequences and what were you just sometimes have to shake your head. We humans look at it and say, well, we don't know what most of this DNA does. And so we'll just consider it useless. That kind of hubris is just always amazing to me. I mean, if it's there, it probably serves some purpose. It just should be a challenge to us to figure out what it is, not to dismiss it as it's probably useless. But CRISPR has completely revolutionized that. But there's a company called Pairwise that's making new produce with CRISPR. That's their goal is to make it more delicious, to make it easier to grow, to make it more affordable, all sorts of things that they could do. But what they find is when they talk to consumers about it, consumers are really excited. They say they're using CRISPR. It's just the same things that could happen through normal breeding. It's something that, and the consumers are all excited. But then they make this one statement. They say, and it's not a GMO. And as soon as they make that statement, they lose the consumer. And even after that, even if they explain to them, it's just once you put those two things out there, they start thinking, wait, is CRISPR not a GMO? You raised GMO. Why is it not a GMO? Maybe it is. And so, I think it is something. I think there's just something that you all can help lead, but we need to understand that in the world of challenges we have, science provides answers, and we need to embrace those answers, not simply say that, the technology itself is the problem, not the products it develops. Maybe we do two more.
Sure, sounds good. Thank you. So we'll go to Danielle and Kian. So Danielle, you can go ahead with your question from Delaware.
Hi, my name is Danielle, and I am a current senior. Thank you for the presentation. I found it especially insightful because of my own interest in epidemiology as a healthcare career. And my question is, how can we implement nutrition to low-income areas who don't have healthy food choices or can't afford these choices to begin with in their areas?
A great question, Danielle. I mean, we're starting because we're doing incentive programs. So SNAP, for example, now has a program that can provide a small number of people additional money to buy produce. There's it's called now the Gus Schumacher Nutrition Incentive Program, but it reaches such a small number of people. And so while I think you can do that, I think there's SNAP Education is a program USDA has. But again, to me, in some ways, it's an example of a little bit of the, SNAP Education provides now $500 million. That's 10 times CDC's nutrition budget and 20 times FDA's nutrition budget. And its only mission is to help prevent obesity in low-income children and to help educate them about nutrition. But not of that 500 million, not $1 goes to low-income people. Really, it goes to all the people providing the services who are great people. They're dietitians, others. They're really well-meaning. They're trying to do great work, but and they're all making a good living off of it. And we need to figure out a way how to use these programs that really do help people. But unfortunately, Danielle, what I've concluded and what I'm pushing for as policy is that we really need to make sure the kinds of foods that low-income people depend on to eat don't make them sick. It already is the law. We need to change those foods, and people need to demand that and say that, of the government. I mean, companies, they can say that too, but it's hard. Today, it's hard to vote with your food dollar because it's just too expensive. And so, how do you have a food that's inexpensive, that's time-saving to make, that tastes great, but that's actually good for you? We can do that if we invest in the science and make it a priority. So sorry to say, last question. I'll also just say before I do that, this was terrific. I should have listened more to Siam. He told me that I give lectures every day as a professor, and so particularly since we've moved to Zoom, it's always hard to get questions, and so I always get a few, but nothing like this. He said there'd be 100 questions, and I didn't believe him, but there really are, and so I'm sorry I didn't leave more time. I will try to provide more information, but this will be my last question, because actually I have a meeting with some senators and others to figure out how we enact some of these policies that I'm talking about.
Well, thank you. So our last question will go to Kian from Missouri.
Hi, Professor Mande. This has been a really interesting talk. I've learned a lot, honestly. And I really wanted to ask you about sort of the prospects of pharmaceuticals when it comes to mitigating sort of the obesity epidemic, especially Wegovy. And I want to know, in a sense, how you see those pharmaceuticals impacting this mitigation attempt.
That is a great question there. So, and I'll try to fit in and answer in the time I have, because it really does underscore a really critical aspect in terms of our science and knowledge, which is, I mentioned earlier, we just don't know what causes obesity. So I will back up, because I think this is an important message I wanted to leave you with, is that all of you, particularly anyone who's ever been on a diet or knows people that understand the situation, human beings through evolution only know two conditions. There's normal and there's famine. That's it. And there's no such condition as overeating and obesity. It exists now. It's half our population, but it's existed in such, in evolutionary times, it's like a microsecond. It's been such a short period of time. And so what's important to know about that is your body, when you go on a diet and you try to eat less as a way to lose weight, all your body does is go, oh, famine, dealt with that for a million years. I know what to do about that. And so what any diet you really follow is going to cause you to lose weight, and your body's nose isn't going to put up much of a fight because that's just famine. We deal with it all the time. But what your body's designed to do is make sure you gain that weight back in 5 years. That's how we deal with famine, because when you're in a famine, there's just nothing you can do about it. That's how evolution learned. It's not that you can go get the food somewhere else. It's a real famine. There just isn't food. So you're not going to have enough to eat. You're going to starve. You're going to lose weight. And that's, we've evolved to deal with that. And we've evolved to make sure we gain all the weight back in 5 years. And so that's really that problem we haven't solved. And it's really cruel that in America, we in other countries, we spend so much on and present to people that somehow dieting is going to work when it really won't work. It will work to lose weight. So if the only reason you're dieting is to fit into that outfit for the upcoming event, it will work for you. But if you're trying to lose weight to get to a healthy state and have it last for the rest of your life, it won't work. There have been studies on identical twins where one of them gained 50 pounds and one of them didn't. And the one who gained 50 pounds lost all that weight. And so now they're both again at the same weight. And then they eat the same diet going forward. And the one who had gained the 50 pounds gains that all back, whereas the one who never gained the weight doesn't gain. This is an identical twin. So there's nothing biologically happening. All that's happening is that our brains have been wired through evolution to assure that, we have famines, and when they're over, we gain the weight back. So to get to your question, that the treatments, the diets we offer, all the things up to now, even a lot of the diet drugs that have occasionally become available, have not been able to figure out how to change that. Because the issue is, can you change your set point in a way that allows you to lose the weight and keep it off? Today, there are a few things that actually do work. One is exercise, not moderate exercise, but intense exercise, like going a soul cycle every day or riding a Peloton every day. If you do that, that kind of high intensity interval training, HIIT, those who know that seems to work to keep that weight off once you've lost it. But you got to keep doing that. And whenever you quit doing it, then the body remembers and brings the weight back. And so it's just super hard to keep the weight off. Now, this new group of drugs, these GLP-1 drugs that you mentioned, one of them, seem to be able to make a shift in the brain that allows your brain to not crave food anymore. And it's really fascinating. And I don't have time to get into all the science. You probably know some of it, but for others who are on here, it's interesting when you start asking why people eat the way they eat. And overeat, there's a lot going on in the brain that makes that happen. And some of it, it's a two-part thing. There's the pleasure you get, and pleasure has to remain, as I said, food has to be delicious. Pleasure has to be at the center of what food is. It would be, if the drugs took away the pleasure of eating, then they wouldn't be a solution at all. It just wouldn't be worth the cost. But it does seem that these drugs don't seem to take away the pleasure from eating, but they do seem, there's a second part of sort of pleasure and addiction and how things work is also there's something that's where your brain craves something. So it's not the pleasure you get from it, but it's sort of the anticipation of the pleasure, and your brain sort of craves it and wants to get it. And so it's not the pleasure itself, but it's this anticipation of pleasure. And these GLP-1s seem to be able to affect that in a way that limits that. The problem with these drugs is that we've only used them this way for less than 5 years. And so I've talked to the investigators who are working on it. They're just going over the 5-year data now, and they already see, I mentioned before how your body is programmed to keep the weight, put the weight back on. And they're already seeing, even after 5 years of people on this drug, that they're starting to gain weight back. And they just don't know where the line ends up. Does it plateau at another place and they still keep the weight off? Or does it allow them to, or eventually are they just going to go back? The body, it's something else that you're tricking the body. It kind of gets it, but eventually it figures out a way around that too and gets back to the weight it needs to deal with a famine. That's kind of the answer I have time for. So I think they're promising. I think they, what's exciting is they're sort of looking more at the right kinds of targets that might be overall successful. I think it's just too early to tell with this group of drugs whether they will get there. I think the evidence really is mixed. I think it should, we have nothing near the evidence that suggests that it's a drug that should be given to children. Because right now, what we do know about these drugs is they work as long as you keep taking them. And as soon as you stop taking them, the forces in your brain that I mentioned that are trying to return to pre-famine state are in play, and so that's that. Anyway, again, Siam, others, thank you so much for giving me this opportunity. It is so nice to talk to all of you. I wish you well. Congratulate you again for doing the hard work that got you into this program, and know that you will continue that as you go off to college and really become the participants in society that have the ability to change this in the future. And in the meantime, early at the beginning, I mentioned I was at the Tisch, there's a Tisch College of Civic Life at Tufts. I'm on the faculty, and its mission is to ensure that every Tufts graduate is a lifelong voter. So that's the thing that I will leave you with on all of these issues. The number one thing you all can do, if hopefully your countries allow you to do that, is vote. And that's how we get change. And again, thank you all very much, and wish you all well.